My name is Dr. Janet Neigel, and I'm a board-certified ophthalmologist. I've been in practice since 1986. My practice is half reconstructive or functional, both surgical as well as medical treatment for functional problems. My other half of the practice is aesthetic or cosmetic, although there's a lot of crossover in between the two. I also work with a plastic surgeon who does a lot of body work in my office for liposuction and for breast augmentation.
One of the reasons that I had selected her and one of the reasons that she came highly recommended was because where certain cosmetic surgeons or estheticians or whatever focus mostly on aesthetics, she was a cosmetic surgeon that also had a very significant medical background.
I started getting interested in cosmetics as soon as I saw my first wrinkle. I knew there had to be a better way than the old facelifts of yesterday. Nobody wants to look like Joan Rivers and have their face pulled all the way back. People want to look natural. I think as a female, I can relate to my patients a lot more. They know they can trust me, and I would never do anything on a patient that I wouldn't do on myself or a family member.
She put before me a buffet of options with great detail, and she explained them to me. She explained what I could expect from them, what they would cost, what kind of inconvenience they would be to me, how my skin and someone my age and someone with my lifestyle would react to those things, and she let me make the choices.
I said, well, why do I have to do the brow lift if I'm getting my eyes done and my eyebrows look okay? And Dr. Neigel explained the muscle theory, that when the muscles droop, when you get older, your muscles will droop and everything. And yes, I can do the eyelids and they'll look good, but they'll look great if you do the brow lift. And I said, okay, I think I've taken off 10 years, at least 10 years. So I'm feeling really good.
I'd heard from a lot of people about Dr. Neigel. My dermatologist, there was some ladies in the office talking about her. Went home, looked her up online. I'd been to other doctors that have done various things, but not as comfortable as I was the first time I met Dr. Neigel. And in the last 5 years, she has really just done minimal, but kept me where I just feel really good every day.
The other thing that's great about a lot of the treatments that we can do nowadays is they're considered lunchtime treatments. Most of my patients are working women or moms that have kids in school for a limited amount of time and they have to be available. They come in on their lunch hour, they do the treatment, throw on a little makeup and go about their business. And me, everybody thinks, you know, I have unlimited access to cosmetic surgery. Well, yes, I do, but I'm a mom of 3 and I have a very busy practice, and all I've done on myself have been lunchtime treatments.
You come out, and I walked out of her office, and by that night I went out to dinner, and I was fine and nobody knew. Everybody said to me, you look well rested. Everybody said to me, have you been on vacation? Everybody said to me all the things that you would hope that they would say, and not, did you have something cosmetically done?
I came to see Dr. Neigel one day, hoping that she could convince me or help me feel good about myself, or at least look better, and she recommended some Botox. And over time, I started to notice that my face was fuller, my eyes weren't so red, the dark lines under my eyes weren't so dark, and I really started liking the way I look.
One of the things we do at the practice in order to help introduce new patients to the practice in a very non-threatening way is to have an open house, usually 2 or 3 times a year.
She's got food and hors d'oeuvres and seminars, and people are talking, and the reps from all these companies come in and everybody mingles, and old patients come in to meet new patients, and people can ask questions and go, oh my God, wow, what did you do? And before and after pictures are coming out, and people are talking about their experiences, and it's just a lot of fun. But my favorite thing of all, and I just went in October, is something called the Secret Beauty Getaway.
And what we do is invite women or men or couples to come for a few days, a weekend, long weekend, to some nice destinations such as New York, such as Florida, where I do happen to have medical licenses. And they get a vacation. The last one was at the Breakers Hotel in Palm Beach. We do some lectures on skincare and taking care of yourself and some of the new lunchtime treatments. And then if anybody wants to have a lunchtime treatment, they can while they're there.
And when you go home, Nobody knows that you saw a cosmetic surgeon. Everybody thinks you just had a little R&R, and it's fantastic.
Confidence is really important in life, and it takes sometimes the smallest thing just to boost our confidence. And I found, especially with women going back into the job force, or a lot of people have lost their jobs, their spouses, either through death or divorce, and they need that little something to feel better about themselves in order to excel and get that new job offer.
It's not just how she's made me look, it's the inner feeling that she's given me. I feel confident, and you know, I'm 48, so what she's done for me over the years has really even helped my job and given me confidence in other situations.
I can't stress enough the gratitude that I feel for Dr. Neigel, because it sounds silly, but she changed my life. She changed my day-to-day existence, how I approached people, how I approached men who eventually became my husband. She changed the way that I approached meetings and how confidently I felt in those meetings. She just really made a big difference. I still don't think today she knows what a big difference she made.